and welcome to the Campaign for Action's first joint learning collaborative with the historically Black colleges and universities, the Hispanic serving schools of nursing, and Native American serving schools of nursing, some faculty and deans. I am so grateful to all of you, and on behalf of the Campaign for Action, we are also grateful to you for taking the time out of your day to be here to explore the National Academy of Medicine's 2021 Future of Nursing report. So you have been invited today as part of our continued efforts to support students from diverse backgrounds to remain in school, to graduate, and to pass the NCLEX. I just mentioned our audiences, our combined audience, and we also have partners joining us today. They include representatives from the Office of Minority Health at the Department of Health and Human Services, the White House Initiative on Historically Black Colleges and Universities, Chi Eta Phi Sorority, the National Association of Hispanic Nurses, and the National Alaska Native American Indian Nursing Association. So as many of you probably know, in 2014, the Robert Wood Johnson Foundation committed to build a culture of health and to achieve health equity, and that would give everyone a fair and just opportunity for health. And before I go any further, I do want to point out that the Campaign for Action that's hosting today's webinar or convening learning collaborative is a joint initiative of AARP Foundation, AARP, and the Robert Wood Johnson Foundation. So again, in 2014, the Robert Wood Johnson Foundation committed to building a culture of health and achieving health equity to give everyone a fair and just opportunity for health. That is why the Robert Wood Johnson Foundation sponsored the first report on the future of nursing. It's one of the reasons why, and then helped us create the Future of Nursing Campaign for Action to advance the 2010 report recommendations. In 2019, Robert Wood Johnson Foundation asked the National Academy of Medicine to chart a path for the nursing profession to create a culture of health, reduce health inequities, and improve the health and well-being of the nation. The National Academy of Medicine formed a committee to develop a consensus report based on the available evidence. This report recognizes that nurses need robust education, supportive work environments. It means nurses, and frankly, also some auxiliary health sectors, such as certified nursing aides. And again, it's to play a central role in advancing equity. Today, we're going to roll up our sleeves to work on charting a path to achieve health equity by looking at the importance of solidifying a diverse nursing workforce, which starts at each of your schools of nursing. Just over a month ago, or a few weeks ago, actually, quite a bit of it with the efforts of Jasmine Cooper, my colleague who is producing today's Learning Collaborative, and our MC, Dr. Piri Ackerman-Barger, as well as several of our diversity and inclusion consultants. The campaign released our 2021 edition of our Health Equity Toolkit, a resource which you can easily find at the campaignforaction.org. So with that, let's get started. I'm delighted to turn the program over to my friend and colleague, Dr. Piri Ackerman-Barger, who will provide a brief overview of the report's recommendations and explain how today's Learning Collaborative will run. Take it away, Piri.
Thank you, Wynn. It's my pleasure to be here with you today. I personally have found myself quite inspired by the recommendations. So let's just go over them briefly. Recommendation 1 is about creating a shared agenda, recognizing that when nursing professional organizations, academic settings, when we come together as nursing disciplines, that we have an amazing cognitive power to create change, and that there's a lot of power in that process. Recommendation 2, this is one of the ones that we will be focusing on today in the breakout groups. And this is the idea that we need to support nurses to advance health equity, whether that is through education, getting the skills, having the infrastructure from a national standpoint or within institutions, et cetera. We need the support to do this thing. Number 3 is about promoting nurses' health and well-being. And what's wonderful about this recommendation is it acknowledges that health and well-being transcend physical, mental, emotional, spiritual, family, and social, and it also addresses race and racism in our country. So recommendation 4 is capitalizing on nurses' potential. This really speaks to a scope of practice and that nurses have the skills and scope of practice to do more than we're actually used for. So there's been ongoing talk about that, and we will continue to have conversations about that. Paying for nursing care. This addresses payment systems and rethinking the way that nursing care is acknowledged and potentially reimbursed. So more conversations on that. Number 6, using technology to integrate data on social determinants of health into nursing practice. So during the pandemic, I think that a lot of us got some insight into how valuable, how important technology can be in connecting us with each other through telehealth and telemedicine, the way that we teach and learn, and also the way that we, and indices. Number 7 through 9, those recommendations are strengthening nursing education. And so there's a lot under this recommendation. This is another one that we will be addressing today, that we need to be teaching different content or additional content. We need to be teaching in different ways. We want our students to come out of their schools of nursing being equity minded with the skills and desire to create health equity. Number 8 is really important. We have seen this so much in the last year and a half that we need to prepare nurses to respond to disasters and public health emergencies. In my 25 years of being a nurse, I've never been more proud to be a nurse. Nurses really made a huge difference in the response to the COVID-19 epidemic or pandemic. But what we know is that even though we came and stood up and were there and available, it was hugely taxing. That came at a lot of personal cost to nurses. And we need to change the system so that we are ready to respond in a way that doesn't take so much out of individuals and our profession. And then number 9, we'll be talking about today as well, is that we want to base our actions and our strategies on the evidence. And we need to be continuing to do that. And we will strategize some ways to do that. All right. So we are going to get into breakout groups today. And what I would like to do at this point is to walk you through the process, what we will be doing in our breakout group. So we have 3 fabulous and amazing facilitators who agreed to join us today. We have Barbara Nichols, who's Executive Director of the Wisconsin Center for Nursing and co-lead for the Wisconsin Action Coalition. We have Vernell DeWitty. She is Director for Diversity and Inclusion for the American Association of Colleges of Nursing. And we also have Deborah Stamps, Executive Vice President, Chief Nursing Education and Diversity Officer for Rochester Regional Health. So they will be your facilitators. So this is what you're going to do once we get you into your breakout teams. So we want you to review the assigned recommendation and sub-recommendations from the report, and your facilitators will have that information for you. You are going to complete the action planning template for your sub-recommendation. I will go over that template in just a minute. And after 15 minutes of discussion, you'll return to the larger group and report out. And you will be sharing what you have on your action planning template. That helps have us give us a visual clue of what it is that we're doing. So this is the template. You'll see that number 1, you will be addressing the key strategic stakeholders. So even though there's 3 bullets here, please don't be limited by 3 bullet points, as many as you want, thinking outside of the box about who potential stakeholders could be. And then number 2, you're going to think about top 2 to 3 actions for 2021 or the next 6 months. So these are the short-term actions that should be taken to move that agenda forward. Then number 3, what are the top 2 or 3 actions that really look at the next 12 months? So this is a little bit of longer term planning. And then down there at the bottom, you want to write down what your success indicators would be. How would we know if we have met the actions and we've been successful in our efforts, given what you've written on your template? So during the report out, there's going to be a high level summary. We'll talk about the topic itself, who the key stakeholders were, the 6-month and 12-month actions, and the success indicators. And then I will help facilitate that conversation after that. So recommendation 2. So one of the things that we're going to be focusing on is recommendation 2. This is supporting nurses to advance health equity. You can see that there are multiple sub recommendations. If we had all the time in the world, we would go over each and every one of them. But we're going to have you focus on the highlighted recommendations. Again, you will see these when you get into your breakout groups. We'll be focusing on 2.1, 2.5, 2.7, 2.10, and 2.11. We are now going to go into our 15-minute breakout. So again, introduce yourself, review the recommendation, the sub-recommendations, and work on that template, and we'll come back as a group and see what you've come up with. Welcome back, everyone. It's kind of weird to get pulled in through the vortex, isn't it? So I know that 15 minutes probably doesn't seem like enough time to solve the world's problems, but we are very interested in what you came up with. In terms of the report out, we didn't say who would go first. Barbara, would it be okay for me to call on you to report out first on your group? Okay.
We had recommendation supporting nurses to advance health equity, and I'd ask my scribe to share our screen. Can she do that so you can see what we said? Yes. So I think what was key of our observations is that nurses themselves at all levels need to be informed about this recommendation and goal, and they need to be encouraged to collaborate and seek partners at a variety of levels. We also think that a priority action step would be informing, educating key stakeholders regarding the recommendations in order to get their buy-in, and then out of that, going to our action step, which would create informational and educational partnerships that would be action-oriented for helping nurses achieve this goal. Certainly a benchmark would be our ability to not only identify the key stakeholders, but to get them to meet and partner and come up with joint actions. That would be a benchmark.
Thank you so much, Barbara. The point that you're making about this is that there are a lot of people that still don't I still find myself explaining what social determinants of health are and health equity are. And so for this group, it would be easy for us, since we've been engaged in this work for a long time, to think, yay, we can just move forward. But some of that is going to be letting people know and bringing people in and getting people excited by this work. So I'm really excited about the numerous different people that you outlined as stakeholders, and that there is this fundamental piece about we've got to bring people in and let them know that nurses have the capability are important to do this and that this work is necessary. Wonderful.
Yes.
Yeah.
And one other final implicit understanding that wasn't spoken, but I'm interpreting as the facilitator, is that healthcare entities, specifically in the general public, will not see nurses as key agents for this kind of action and activity in terms of health equity. Even though the profession has a long history of advocacy, it is not necessarily acknowledged or affirmed in these arenas that we will need in order to be successful. So I think there's just a lot of work that needs to be done.
Wonderful.
Okay, thank you for your time and attention. We'll move on.
Okay. So recommendation 7, remember this one is strengthening nursing education. So this is asking us to look a little bit more deeply into how we've been doing this and what changes we need. So I didn't clarify last time. There were many recommendations under 2. If you can't get both of the sub recommendations here, it's okay to pick the one that you want to work on. So sub recommendation 7.1, actions for deans, administrative faculty leaders, faculty, etc., and then actions for National Council of State Boards of Nursing. So let's go ahead. Let's look at recommendation number 7, choose one or the other or both of those, and we will get back into our groups and talk further. Right, do we have everybody back? Does it look like? Wonderful. This recommendation is near and dear to my heart. I'm really excited to hear what some of you came up with. For this round, we're going to have Debbie Stamps report out on the discussion with her group. And please feel free to share the template, whoever is the scribe for that group.
Thank you. Alexia is going to share the screen for us.
Okay.
Wonderful. Thank you. We had really great dialogue and discussion on this recommendation. We really truly believe that the key stakeholders have to be the schools of nursing, both from a dean perspective as well as the faculty. Engaging in ANCC for a specialty certification in this space around whether it's DEI or health equity. The National League of Nursing and the School Boards of Nursing, our accreditors have a role in assisting us in realizing this recommendation, as well as employers and practice partners. And the Diverse Nursing Organization, NCEMA, could also have a role in partnering. We spoke a lot about actions for 21 and 22. Everything we were going to do in 21, we decided we had to go back and share it across both years. So we were being very ambitious. But we thought, first of all, we needed to identify what are the drivers of health equity and have a common language. We know that definitions have changed over time, and it really is important that we all are teaching, regardless of the students that we're teaching, we all need to have the same vocabulary and foundational knowledge. We wanted to identify expert nurses and other professionals in this space to inform us. We wanted to also ensure that we have some existing curricula, and is there a curricula that we can, or content, course content that we can build in for cultural humility and for diversity, equity, inclusion. We know that the language today is not competency anymore. It's shifted to humility. We wanted to train our deans and faculty together so that everyone is hearing the same information at the same time. And then how does that information that's educated on or trained on get disseminated into the curriculum? Again, so that there's common language, that we all moving or rowing the boat together in the same direction. We had a great example to develop a clinical faculty academy, which faculty can continue to go back and continue their continuing education on this topic. Missouri Faculty Academy is an example of that. We wanted to put that out there as maybe something that can be replicated or more widely disseminated. Also, the fact that AACN has a diversity toolkit, diversity, equity, inclusion toolkit that can also be disseminated and be foundational, sharing that across. And we wanted to work with our accreditors to ensure that there is competency around the social determinants of health and how that's integrated into the curriculums from a consistency perspective or a standard. The success indicators, wanted to make sure that the first thing was that we had common language across all levels of nursing. If we could achieve that, that would be huge. That way that we're teaching consistently when the nurses are practicing. And it's really going to require our community partners or our practice partners also, because the healthcare settings could be also using yet another language. We felt that 80% of the faculty having the training will have participated in the training, which would be great for professional development for diversity, equity, inclusion. And then we got caught short here a little bit, but we wanted to also think about what is the percentage of curricula that have health equity or diversity training built in to the curriculum for the students. Winifred?
Thank you, Deb. So I'm wondering if another success indicator could be, I don't know what the number or the percentage would be, but it would be a significant percentage increase of the number of deans and faculty of color in nursing schools.
It's an excellent one, yeah. At the leadership of the schools of nursing, absolutely. Because I think there's also program directors that could also have a level of diversity. So it's the leadership of the nursing schools, absolutely. Dawn?
In our group, we were also discussing student and maybe some pre and post survey beginning and end of program to evaluate whether or not the program is actually increasing their awareness of this cultural humility.
Excellent.
You guys have so many amazing things in here. I really love you talking about the common language. I can't tell you how many meetings and sessions I've had with people where we never talk about action steps because we're so busy like arguing the language. So if we could just get that set, then we could move on to getting the really important work done. I was really impressed with the letters D and F. To me, those go together, that you would assess what's working well in your nursing curriculum, right? And then you would go into F. I mean, everybody's curriculum, given what it is we're trying to accomplish, everybody's curriculum is going to need a reboot, even if you have a beautiful curriculum. So how would we go about doing that? And that also, to me, ties in with B, that we need to have experts. So could there be programs? Could there be tracks that people could take? And maybe it would be through different faculty academies like this Missouri Faculty Academy. You know, I'm going to be Googling that here in a couple minutes. Really appreciate what you say about accreditation and the potential that there is with that. I do a lot of work with schools of medicine with their LCME accreditation, and there's some pretty strong language about diversity of students, of faculty, and now of what is in the curriculum. And that might be something for us to consider as well. So this was just a really great walk through. I'm really intrigued by the 80% of faculty will have participated in health equity professional development. I mean, ideally it would be 100%, but a benchmark could be something around 80%. So thank you so much to the group. Were there any questions or comments or final notes on this topic?
Team,
Yeah,
anything else to add?
we just noted that everybody's going to be implementing the new essentials. And if we could piggyback onto that somehow, it would give us more bang for the buck, rather than trying to start a separate program when everybody's already overwhelmed with dealing with that. If we could slip something in with some of the explanations and the essentials or something.
Not everybody uses the essentials though.
Yeah.
Everybody will be doing next gen. So maybe with next gen,
Okay.
Yes,
yeah.
that's key.
But I get your point, Dawn, that we are often overwhelmed. And so having this entirely new structure, you know, people could be overwhelmed and set it aside. So if we can integrate it into things that we're already doing,
Right.
that makes it seem like it is something that is surmountable and potentially even inspiring.
Right.
Thank you for that. And I think that that also ties into the idea of wellness, right? Nursing wellness, nursing faculty wellness. Wonderful.
Thank you.
So we are going into our final breakout room where we're going to talk about recommendation number 9. This is building the evidence, and there's 3 sub recommendations. We're going to do 9.3 through 9.5. Again, it is absolutely okay to pick one of those that really speaks to you. If you want to try to tackle more than one, that is absolutely okay. So go ahead and get into your groups, review this, and then Vernell DeWitty will be reporting out on that last piece. So go ahead and get into your groups now. All right, it looks like we're getting people back. What I would like to do is to hand it over to Vernell DeWitty to do the report from their group for recommendation number 9. And if the scribe from that group could share screen, that would be amazing.
Mute myself. We actually were a little bit challenged to get all of this done. We decided to address the sub-recommendation on using evidence-based approaches to increase the number and diversity of students from disadvantaged backgrounds. So our recommendations for that, first of all, the stakeholders would be high schools, middle schools, so that early on students become aware of what nursing is and how you get admitted into nursing schools. We also identified as stakeholders organizations that might provide funding and support for scholarships, as well as national organizations that are focused on pipelines for nursing. We also, then for our actions, we thought that there were enough work that had been done, and we should evaluate some of the models for their success and then replicate those success models. Another action would be to look at how do you prepare students as they enter the nursing programs, and then of course using a different admission selection process, specifically holistic admissions review. In terms of the long-term actions, beginning to educate high school counselors about what is required for students to enter into nursing schools, because most high school counselors are not aware. And then also to create nursing school partnerships with many of the schools so that students learn what nursing is. Many schools of nursing now offer what's called nurse camp in the summer for high school students. Another recommendation would be to enhance the perception of the value of nursing as a career. There's been some research done, especially with underrepresented groups, whereby families do not value nursing. And if students are smart, they make recommendations. Well, why don't you go to medical school? Because they really don't understand or appreciate fully the value of nursing. And then also to look at establishing pre-apprenticeship programs, looking at the Department of Labor as being one way of doing that. We didn't have a lot of time to get into success indicators, but we did of course, the big indicator would be an increase in the number of underrepresented persons. We did not specify by what percent. Also, increased retention of students who are in schools of nursing and come from underrepresented backgrounds, and also an increased use of holistic admissions review practices in nursing schools throughout the country. So that was our rapid fire report.
That was a wonderful rapid fire report, Vernell. I really resonated with what you were saying about the early pipeline, middle school and high school, and the many dimensions of how important that actually is. So that was great. The idea of a summer camp. Oh man, wouldn't that be, that would have been so fun back in high school to go to a nursing summer camp. Just some really great ideas. I also appreciated that you talked about existing models, because there are some models out there that are really great, and we don't necessarily need to reinvent the wheel, but we may need to share more widely what some of those models are. So wonderful discussion. Wen, I want to hand it back to you for closing remarks.
Thank you so much, Dr. Ackerman-Barger and Dr. DeWitty and Dr. Nichols and Dr. Stamps for all of your work today. Piri for emceeing, for our other three leaders for facilitating, and also for our scribes, Anita Jackson, Stacy Sampson, and Dr. Alexia Green. So thank you so very much. We have 6 minutes left, so I just want to say I think today has been a fantastic discussion, and I actually hope this is the beginning, and I hope we return to these conversations and integrate your ideas into the mentoring programs that we will have with you, the mentoring learning collaboratives that we will have on an ongoing basis, and create new ideas. So to help ensure that underrepresented students from underserved communities stay in school and nursing school and graduate and pass their NCLEX. So the CCNA team here is going to assemble a summary document that we will share at a later time with all of your action plans. It will go into one, maybe more than one document that each of us can refer to. So, so for each of us, we will be, first of all, we will continue to convene the HBCUs on a monthly or near monthly basis. This today starts the convening of the historically the Hispanic serving institutions. It's the first time that we are bringing you together since our mentoring workshop in February. So thank you for joining us. And we are going to start convening you, the Hispanic serving schools of nursing, on a monthly basis as well. And in September, on the 15th and 16th, the campaign is going to bring together Native American serving schools of nursing for their mentoring workshop. And then we will follow up with the Native American serving schools of nursing, or the National Alaska Native American schools of nursing, and then convene them monthly. And quarterly, we would love to bring the 3 sets of schools together to continue to identify or to start to identify areas that each of the groups can work together.
Can I ask a question?
Yes, Debbie.
Are there any thoughts about meeting with those stakeholders on the national level? Next Gen will be incorporated in the spring of 2023. So is there any opportunity that we can actually meet with those stakeholders to share our findings, our work from today?
I think that's a great idea. And maybe that could even be that could be possibly the first joint meeting or the next joint meeting with the 3 sectors, one of the quarterly meetings. Does that make sense?
Yes.
And then other ideas for learning collaboratives before I really wrap up. And that doesn't mean if you don't weigh in now, you can always reach out to Jasmine and me, or Jasmine or me, or Dr. DeWitty. We will be pulling these learning collaboratives together. So before I go, I just want to give a very heartfelt message of gratitude to my teammate, Jasmine Cooper. Jasmine not only produced this logically, she really, she convened the thought leaders to pull the plan together. When I was on vacation, pulled a lot of the plan together, even on her own, and we reflected back with our work group that created it, and the group improved it even more. So it's just such a pleasure to watch Jasmine take the initiative and be a leader in this space, and it's so great to work with you. So thank you for all of your work.
Thank you.
And so with that, I hope everybody has a lovely summer. Hopefully we will see some of you at different points of the summer. And if not, we'll see you in the fall. So
could I answer Dr. DeWitty's question? She had a question about a next gen. It's the change that is coming for NCLEX.
Okay.
And it's happening spring of 2023. So it'd be a perfect opportunity to get in on the ground level where are able to get some measurable outcomes. If all the schools of nursing have students that are graduating, taking NCLEX, then everybody will be touched by our changes.
okay. And in fact, we might even expand the audience for that convening, because I think it would be helpful for many schools of nursing to hear about that. Okay, terrific. So, and I also want to give a heartfelt message of gratitude to all of the nurses. So on behalf of AARP's nearly 38 million members, we so deeply appreciate everything that you do for patients and their families. And we also are deeply thankful and grateful to you for helping us on our path to achieving health equity through nursing. So thank you so much, and we will see you soon. Have a great summer.